overlap between them. Research has shown that individuals with anxiety disorders are at a higher risk of developing depression compared to those without anxiety. The chronic and relentless nature of anxiety can take a toll on one's mental well-being, leading to feelings of hopelessness, sadness, and despair, key symptoms of depression. The prolonged physiological and psychological impact of anxiety can disrupt important neurotransmitters and hormonal systems in the brain, further exacerbating the risk of depression. Additionally, the social isolation and avoidance behaviors commonly associated with anxiety can also contribute to the development or worsening of depressive symptoms. Overall, while anxiety does not directly cause depression, it can certainly increase the vulnerability to and severity of depressive episodes. It is crucial for individuals experiencing anxiety to seek appropriate support and treatment to mitigate the potential risk and impact of depression. Can anxiety make you feel sick? How can I control my anxiety without medication? Absolutely. Anxiety is not just a psychological condition. It can also manifest physically, causing a range of uncomfortable symptoms. When anxiety levels soar, individuals may experience an array of physical sensations, including rapid heartbeat, shortness of breath, dizziness, and even digestive issues like nausea and stomach aches. These physical symptoms occur due to the body's natural stress response, as anxiety triggers the release of stress hormones like cortisol. These hormones can interfere with the normal functioning of various bodily systems, leading to a sickening feeling that can be deeply distressing and overwhelming. So, it's crucial to recognize that the effects of anxiety extend beyond the mind, impacting our overall well-being. How anxiety affects the body. How does anxiety affect your daily life? How anxiety affects the body can be both physically and mentally overwhelming. When a person experiences anxiety, the body's fight or flight response is triggered, releasing stress hormones like cortisol and adrenaline. This leads to a range of physical symptoms such as increased heart rate, rapid breathing, muscle tension, and sweating. Additionally, chronic anxiety can weaken the immune system, making individuals more susceptible to illnesses and infections. The long-term impact of anxiety on the body may extend to digestive problems, sleep disturbances, and even cardiovascular issues. The toll anxiety takes on the body emphasizes the importance of seeking treatment and developing effective coping strategies to manage this condition. For more videos, please subscribe. Understanding and managing separation anxiety in children. Separation anxiety is a natural developmental phase that most children experience at some point. It typically peaks between 8 and 18 months of age, but it can also occur in older children and even adults. This anxiety stems from the child's fear of being separated from their primary caregiver, usually their parent or guardian. Signs and symptoms of separation anxiety in children: excessive crying and clinging to the caregiver when they leave, tantrums and meltdowns at the prospect of separation, difficulty sleeping alone, frequent nightmares about being alone or separated from the caregiver, physical symptoms such as stomach aches, headaches, or nausea, refusal to go to school or other activities without the caregiver, fear of strangers or new places, difficulty making friends. Causes of separation anxiety. 1. Developmental stage. As mentioned earlier, separation anxiety is a normal part of child development. It occurs as infants and toddlers begin to understand the concept of object permanence, which is the understanding that objects continue to exist even when they are out of sight. Temperament. Some children are naturally more sensitive and prone to anxiety than others. 2. Parental attachment. The quality of the child's attachment to their primary caregiver can play a role in their development of separation anxiety. Children with secure attachments are less likely to experience separation anxiety than those with insecure attachments. 3. Life events. Significant life events, such as moving to a new home, starting school, or welcoming a new sibling can trigger separation anxiety in children. How to help a child manage separation anxiety. Gradually increase separation time. Start by leaving your child for short periods, gradually increasing the duration over time. This will help them get used to being apart from you and build their confidence. Create a predictable routine. Having a predictable routine can help children feel secure and safe. Establish a consistent bedtime routine and let them know what to expect each day. Use transitional objects. Transitional objects, such as a favorite blanket or stuffed animal, can provide comfort and security for children when they are separated from their caregiver. Play separation-themed games. Play games that involve pretend separation, such as peekaboo or hide-and-seek. This can help children practice being apart from you in a fun and non-threatening way. Conclusion: separation anxiety is a common and often normal part of child development. By understanding the causes of this anxiety and using effective coping strategies, parents and caregivers can help children overcome this anxiety and develop healthy, secure relationships. If you are concerned about your child's separation anxiety, please consult with a healthcare professional. For more videos, please subscribe. Separation anxiety is a natural developmental phase that most children experience at some point. It typically peaks between 8 and 18 months of age, but it can also occur in older children and even adults. This anxiety stems from the child's fear of being separated from their primary caregiver, usually their parent or guardian. How to help a child manage separation anxiety? Gradually increase separation time. Start by leaving your child for short periods, gradually increasing the duration over time. This will help them get used to being apart from you and build their confidence. Create a predictable routine. Having a predictable routine can help children feel secure and safe. Establish a consistent bedtime routine and let them know what to expect each day. Use transitional objects. Transitional objects, such as a favorite blanket or stuffed animal, can provide comfort and security for children when they are separated from their caregiver. Play separation-themed games. Play games that involve pretend separation, such as peekaboo or hide-and-seek. This can help children practice being apart from you in a fun and non-threatening way. Reassure your child. Let your child know that you will always come back and that you are only leaving for a short time. Use positive and reassuring language. Avoid making a big deal about leaving or returning. Don't make a big fuss about leaving or returning, as this can make your child's anxiety worse. Instead, say goodbye calmly and simply. Stay calm and patient. It's important to stay calm and patient when your child is experiencing separation anxiety. Getting angry or frustrated will only make the situation worse. Seek professional help. If your child's separation anxiety is severe or is interfering with their daily life, it's important to seek professional help from a therapist or counselor. They can provide you with additional strategies and support. Here are some additional tips for helping children manage separation anxiety. Give your child plenty of attention and affection. Create a warm and loving home environment. Encourage your child to express their feelings. Teach your child coping mechanisms for dealing with anxiety. Avoid using separation as a punishment. Be patient and understanding. It's important to remember that every child is different, and what works for one child may not work for another. It's important to find what works best for your child and to be patient and consistent with your approach. By understanding the causes of separation anxiety and using effective coping strategies, you can help your child overcome this anxiety and develop healthy, secure relationships. Conclusion: separation anxiety is a common and often normal part of child development. By understanding the causes of this anxiety and using effective coping strategies, parents and caregivers can help children overcome this anxiety and develop healthy relationships. For more videos, please subscribe. Are anxiety disorders genetic? This is a question that has intrigued scientists and researchers for years. While the exact cause of anxiety disorders is still not fully understood, there is evidence to suggest that genetics play a significant role in their development. Studies have shown that individuals with a family history of anxiety disorders are more likely to develop one themselves. Research has also identified specific genes that may be associated with increased susceptibility to anxiety disorders. However, it is important to note that genetics is not the sole determining factor in the development of an anxiety disorder. Environmental factors, such as traumatic experiences or high levels of stress, can also contribute to their onset. Ultimately, The interplay between genetics and environment seems to be the key in understanding the complex nature of anxiety disorders. Are anxiety meds bad for you? Can anxiety meds make anxiety worse? This is a question that has sparked debates and discussions amongst healthcare professionals and individuals alike. While anxiety medications, commonly known as anxiolytics or anti-anxiety drugs, can be effective in providing relief to those suffering from anxiety disorders, it is crucial to approach them with caution. Like any medication, anxiety meds do come with potential drawbacks and risks. It is important to understand that each individual's response to medication can vary, and what works for one person may not work for another. Hence, it is essential to work closely with a healthcare professional in assessing the potential benefits and risks of using anxiety medications, and to discuss alternative treatments or lifestyle changes that may be more suitable for long-term management of anxiety. Can anxiety be cured? Many people wonder if anxiety can truly be cured. While it may not be possible to completely eliminate anxiety from our lives, it is possible to effectively manage it and live a fulfilling life. Anxiety is a natural response to stress or danger, and everyone experiences it to some degree. However, when anxiety becomes excessive and interferes with daily activities, seeking treatment is crucial. Various therapeutic approaches, such as cognitive behavioral therapy (CBT) and medication, can provide significant relief and improve one's overall well-being. Additionally, self-care practices like mindfulness, exercise, and stress management techniques can work synergistically with treatment. It's important to remember that seeking support, understanding triggers, and developing coping strategies can empower individuals to successfully navigate anxiety and live fulfilling lives. For more videos, please subscribe. Can anxiety cause nausea? This is a common question asked by many individuals who have experienced the discomfort and uneasiness of both anxiety and nausea. The answer is yes, anxiety can indeed cause nausea. When we feel anxious, our body's natural fight or flight response is triggered, leading to various physical sensations, including an upset stomach. This can manifest as a feeling of queasiness, a loss of appetite, or even full-blown nausea. The connection between anxiety and nausea is not only psychological, but also physiological. Anxiety triggers the release of stress hormones, such as cortisol, which can interfere with the normal digestive process, leading to sensations of an unsettled stomach. Additionally, anxiety often leads to hyperventilation and increased muscle tension, which further contributes to feelings of nausea. So, if you find yourself experiencing nausea during or after periods of anxiety, know that you are not alone, and that this physical symptom is a result of the mind-body connection we all possess. Exploring strategies to manage anxiety, such as deep breathing exercises, mindfulness, and seeking professional support, can be beneficial in alleviating both anxiety and the accompanying nausea. Can anxiety cause headaches? How do you get rid of anxiety, tension, headaches? This is a question that has frequently been asked by individuals struggling with both anxiety and headache issues. The answer: yes, anxiety can indeed be a trigger for headaches. Anxiety and stress can lead to muscle tension in the neck, shoulders, and head, which can, in turn, result in headaches. Additionally, anxiety can cause changes in blood flow and circulation, leading to increased pressure and discomfort in the head. The intensity and frequency of these headaches can vary from person to person, but it is not uncommon for individuals dealing with anxiety to experience headaches as a manifestation of their condition. Therefore, it is essential for individuals with anxiety to find healthy coping mechanisms and stress relief techniques to help manage their symptoms and potentially alleviate the accompanying headaches. Can anxiety cause chest pain? How do I relax my heart from anxiety? This is a commonly asked question, as many individuals experience chest discomfort during periods of high anxiety or panic attacks. While anxiety itself is not a direct cause of chest pain, it can certainly contribute to the sensation. Anxiety often triggers physical symptoms due to the body's natural stress response, known as the fight or flight reaction. This response can lead to increased heart rate, shallow breathing, and muscle tension, including in the chest area. These physical changes, coupled with heightened awareness of bodily sensations, can give rise to chest pain or discomfort. For more videos, please subscribe. Are anxiety and panic attacks the same? This is a common question many people have when trying to understand the nuances of these two mental health conditions. While anxiety and panic attacks are related, they are not identical. Anxiety is a broader term that encompasses a range of psychological and physical symptoms, often characterized by excessive worry, fear, or apprehension about future events. On the other hand, panic attacks are intense episodes of sudden and overwhelming fear or discomfort, typically accompanied by heart palpitations, shortness of breath, and a sense of impending doom. While anxiety can be chronic and persistent, panic attacks tend to come on suddenly and last for a shorter duration. Though they are distinct in nature, it is not uncommon for individuals with anxiety disorders to experience panic attacks as a symptom of their underlying condition. Overall, understanding the differences between anxiety and panic attacks can help individuals seek appropriate treatment and support for their specific needs. Are anxiety attacks dangerous? This is a frequently asked question among individuals who experience intense episodes of anxiety. While anxiety attacks can be incredibly frightening and distressing, they are not usually life-threatening. However, it is important to recognize that they can have significant physical, emotional, and psychological effects. During an anxiety attack, individuals may experience symptoms such as rapid heartbeat, shortness of breath, shaking, chest pain, and feelings of impending doom. While these symptoms are uncomfortable and can mimic more serious conditions, they rarely lead to long-term physical harm. Nonetheless, the impact on one's mental well-being should not be underestimated, as anxiety attacks often disrupt daily life, functioning, and overall quality of life. Seeking support from mental health professionals and implementing coping strategies can greatly reduce the frequency and intensity of anxiety attacks, promoting better mental health and overall well-being. Are anxiety and depression related? This is a question that has piqued the interest of researchers, psychologists, and medical professionals for decades. While anxiety and depression are separate disorders, there exists a significant correlation between the two. Many individuals who experience anxiety often find themselves grappling with depressive symptoms, and vice versa. The link between these two mental health conditions lies in their shared characteristics and underlying mechanisms. Both anxiety and depression can be triggered by similar life stressors, genetic predispositions, and chemical imbalances in the brain. Additionally, the negative thought patterns and cognitive distortions commonly found in individuals with anxiety often contribute to the development or exacerbation of depressive symptoms. For more videos, please subscribe.